Hey guys, and welcome to How to Gastro. In today's video, we'll be speaking about a very interesting topic, and that is tonsillitis. So let's get started. So before we get into the specifics of tonsillitis itself, let's do a quick review on what are the tonsils. So the tonsils are two oval-shaped glands, which are actually called lymph nodes, that sit at the back of the throat. So we actually have one on the right side as well as the left side, and they are situated at the posterior part of the oral cavity. The role of the tonsils is to fight off bacteria and viruses that enter the body through the nose and mouth. So usually, the tonsils do their job well in fighting off the bacteria and viruses, but sometimes bacteria or viruses may get into the tonsils and inflame and infect them. When this happens, we say that one has tonsillitis. So from this definition of the tonsils, we get that they're actually these two oval-shaped lymph nodes which are found at the back of our throats. And their importance in the human body is to actually fight off the bacteria and viruses that actually enter our body through the nose or the mouth. But what actually happens is when sometimes these bacteria and viruses penetrate through and completely infect and inflame the tonsils, we get something called tonsillitis. So this is an inflamed and infected tonsil, and this is actually what the tonsil looks like in a normal healthy throat. So this is what the tonsillitis looks like. So I want to jump straight into what is tonsillitis. So tonsillitis is an infection and the inflammation of the tonsils. So inflamed tonsils look red and swollen and may be covered with a yellow or whitish coating or spots. Tonsillitis can occur at any age and is actually a common childhood illness. It's most often diagnosed in children from preschool age through their mid-teens. So this is actually the lateral view of what happens to those tonsils. We see that once they become infected, they begin to inflame quite largely. And we see what the aspect looks like from a normal frontal view. So in addition to being red and swollen, they may also be covered with yellow or white spots, and sometimes they may have a slight discharge of yellow or whitish fluid. And this is actually the typical aspect of what the tonsillitis infection looks like. So moving on, let's talk about what are the causes of tonsillitis. So bacterial and viral infections cause tonsillitis. A common cause of bacterial tonsillitis is Streptococcus or Strep bacteria, which can also cause strep throat. So I did do a very interesting video on strep throat, and I do suggest you guys give that a watch if you have some time. It talks all about the strep throat infection with a specific group A type bacteria called Streptococcus pyogenes, and how this bacteria can actually go on to inflame the uvula, the back of the oropharynx, and as well as contribute to the development of a tonsillitis. So I will put a link for it in the description, and it will be suggested on the right-hand top tab as well. So other common causes include Staphylococcus aureus, Bordetella pertussis, which actually causes whooping cough, and Streptococcus pneumonia, which causes bacterial pneumonia. So these 1, 2, 3, 4 are all bacterial causes. So again, we have Streptococcus pyogenes, which causes strep throat, Staphylococcus aureus, Bordetella pertussis, and Streptococcus pneumonia, which are all bacterial causes. We can then have viral causes, which include the adenoviruses, the influenza virus, the Epstein-Barr virus, the parainfluenza viruses, the enteroviruses, as well as the herpes simplex virus. So these are all the causative organisms which can be included in the development of a tonsillitis. The signs and symptoms of tonsillitis. So these patients usually have a very sore throat, a difficulty or pain during swallowing, and this is called dysphagia, a scratchy sounding voice, bad breath, fever, chills, earache, stomach ache, headaches, a stiff neck, jaw and neck tenderness from the swollen lymph nodes. The tonsils will also actually appear red and swollen, and the tonsils may also be covered with white or yellow spots. The diagnosis of tonsillitis. So the doctor will do a physical examination where they will look at the tonsils to see if they are red or swollen or have pus on them. They'll also check for fever. A throat swab may also be done, and here a cotton swab is run along the back of the throat, and this can be used to test for a strep throat infection, and these samples can also be cultured in a lab to see which specific bacteria or virus has actually caused the disease. So a blood test can also be done, and this will look for high and low numbers of specific blood cells to show whether a virus or bacteria has caused the tonsillitis. So during the physical examination, the doctor will check for the inflammation, the redness, the swollenness, as well as these yellow or white spots on the tonsils. A throat swab can also be done, and this sample can be either tested for strep throat, which is a Streptococcus pyogenes infection, or it can be sent off to a lab to look for other specific viruses and bacteria. As we mentioned, there's quite a few causative organisms in the development of this disease. So blood tests can also be done, and this will check for high levels of specific white blood cells. So if we have a bacterial tonsillitis, we will have an increase in the white blood cell count, as well as specifically the neutrophils. And if we have a viral tonsillitis, we will have an increase in the white blood cells, as well as an increase in the lymphocytes in these patients. And finally, let's talk about the treatment of tonsillitis. So the treatment for tonsillitis depends on the cause. If the cause is a virus, there's no specific treatment to treat it. And if the cause is a bacterial infection, such as strep throat, the child will need to take a course of antibiotics, usually amoxicillin. It is important for the child to finish the antibiotic course even if he or she feels better. Whether the infection is viral or bacterial, these children should get a lot of rest, drink plenty of fluids, try eating soft foods if it hurts to swallow, try eating warm liquids or cold foods such as warm popsicles to soothe the throat. They should stay away from cigarette smoke or anything else that could irritate the throat. They should sleep in a room with a humidifier, gargle with salt water, suck on a lozenge, take an over-the-counter pain reliever such as acetaminophen or ibuprofen, and rarely in this disease, a healthcare provider might recommend a tonsillectomy, and this means surgery to completely remove the tonsils. And this usually occurs if a child's tonsils get infected a lot or they are so big that they make it hard for the child to breathe at night. So in general, a tonsillectomy may be considered if a child has 7 sore throat episodes in a year, 5 episodes within 2 years in a row, or 3 episodes within 3 years in a row. And these will all be reasons for a tonsillectomy. And that brings us to the end of this video on tonsillitis. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.